Those are the ones we see in the pet trade, okay? There's supposedly 3 subspecies of them, but this is the one we typically are going to see, okay? They're typically from the Andes Mountains of South America, in Peru and Chile. Big thing is, remember, they inhabit cold and rocky slopes, so they are also probably one of the longest lived characters, 10 to 20 years. I had one in the clinic that came in that was like 19 to 20 years old. So they can live a long, long, long time. And so geriatric things and stuff you will actually see in the clinic.
The ones that you see in the clinic, usually going to be called. These guys are usually raised for their foot. There's $20,000 coats. Their feet is going to go equal. Comes from these guys. They're called.
Yeah, these are not fur quality typically. Okay, that's a whole different ballgame that I have no clue about. But unless you're working in a barrier type thing, you're probably not going to see those. So they're long-lived little critters. Tons of different color mutations. Okay, so this is where you as the nurse can help me look smart. So when you go into the room and you see one that's not a typical chinchilla coloration, it's really nice to say, oh, how cute he is. Now, what kind of mutation is that? Or what color is that? And then you can come back to me and say, oh, he's supposedly a hetero blonde, blah, 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 and helps me look smart. So because when I was looking through this, it was very, very interesting. There's a lot of different color varieties now, or color mutations in the pet industry. So basics, external anatomy, they have very dense fur covering their entire body, kind of right there. Up to 90 hairs can come from each individual root, okay? We had one of you guys that already knew that. They have little short front legs to support and hold their food, and they have large, powerful legs designed for jumping, okay? Some of these photos, if they're not super clear, it's because they're stolen from the internet, and they're not always the best quality, but that was pretty cute. Digestive tract, 4 incisor teeth, 16 molar type teeth. Big thing, like all rodents, they're open roots. Okay, they grow continuously. So therefore, like we were talking about a week or two ago on the other chinchilla, the correct position of these teeth is crucial. Okay, if they're off or whatever, they'll start having all kinds of issues. This was something I didn't know. They have palatal ridges that distinguish it from other chinchillas. So I guess their palatine ridges are kind of like fingerprints on a chinchilla. Is that true? Yeah. I just found that out. I didn't know that. So that's an interesting little tidbit of information. The dental formulas, they have 2 incisors, 1 over 1, canines, they have no canine teeth. They have 1 premolar and 3 molars, okay, on each side. So if you take a look at these in the skull, most of the tooth, 3/4 of it or whatever, or 2/3 of it, is actually underneath in the bone. See at the top where it says clinical crown? That's the part that's sticking above. The rest of it's sticking below. That becomes really significant later on when you start seeing dental disease in chinchillas, which we won't go through all of that here. That's more than I think you guys need to be dealing with at this point. But that is, again, like with the rabbits, it's one of the primary things that we see issues with is their teeth. Okay. But there you can see the first one is the premolar, then the molars, first, second, and third molar. They have these deep dental ridges and dental grooves with the enamel crests, and that is how they chew. And they're, again, continually growing. Gastrointestinal tract, pretty boring. Similar to every most other rodents. You got a stomach, similar to a horse and a pig. You got a duodenum, you got a jejunum, you got an ileum, you got a cecum. Cecum, similar to other rodents, left side, liquid consistency content is what it should be, taking up a good majority of the abdominal cavity there. You got an ascending colon, a descending colon, recommended anus. Okay, so realistically, you should kind of have a good idea of that. You know, if you were doing a necropsy or somebody were going in on that or whatever, what part of the intestinal tract was looking at. Okay, pretty basic, pretty similar to most other animals. spleen and respiratory tract, urinary tract, and anal sacs. Go read it. Okay? It was basically, yeah, they have them. This is kind of what they look like, but nothing super special about it. Okay? So realistically, I'm going pretty much summarizing that chapter in the book. Okay? But that one, pick up your book, go read it for yourself. Reproductive and urinary tract. This is the part that's really interesting with these guys. So on a female, that is not labial lips, okay, or vaginal lips. That is the, they call it a urethral cone, okay, and it's actually where the urethra comes out. So urethra does not exit inside the vaginal vault area. The urethra exits externally, okay. The vaginal opening is actually in between those two and is typically closed, and then you have the anus. Okay? So and the males don't have a scrotum, and the testicles are considered incomplete, so they don't stick out. So in sexing them, the only way you can really sex them is the anal genital distance. Okay? So in a female, they should be like right next to each other. And that would be, again, the urethral cone, not the vaginal labia there, okay? And then the males, much further distance going out that way, okay? So those are some pretty interesting differences that you see amongst them. Why would anybody think that maybe their testicles don't descend into a scrotal sac?
Their body temperature is lower.
Because what? They live in cold places, right? They descend down into the scrotal sac because testicles are supposed to be a little bit cooler than body temperature, right? But I guess if you live in high cold areas, it doesn't need to come down, huh? So that would be my 2 cents on that. So that's something very, very different amongst them that you should know quite well. Reproductive facts, okay? These are just some of those kind of boring facts that you need to memorize a little bit. Their first heat is very young, 3 to 4 months of age. Okay? Gestational period, I guess it depends a little bit on if they've had babies before or not. 110 to 138 days. Number of young, 1 to 3. Can have 1 to 2 litters a year, and they're precocial. Everybody knows what precocial is? What's precocial versus atrocial? You learned that? Mice and rats have what kind of babies? How are they born? Say it out loud. Don't be afraid. What's a baby mouse look like? Little pink, gnarly thing, can't see or anything, right? So that's atrocial. Precocial means they're ready to go, like your guinea pig babies. Oh, you haven't had guinea pigs yet. Guinea pig babies pop out, they look like little miniature guinea pigs, and they're ready to roll. So these are precocial. Female can return to heat about every 25 to 30 days if not bred. And supposedly, my understanding is that the best way you can tell a female is in heat is how the male is reacting. Okay? Is that true, Doc? Okay. I learned to be a few things. Husbandry. Probably the most important thing you'll deal with is dealing with chinchillas. Okay? That's something you should know the most if you're going to be talking to clients and patients about chinchillas. Because they live up in the cold, they're very intolerant of heat and humidity, right? So their teeth grow constantly. They need ample objects for chewing. So you're going to hear that over and over and over again, okay? They need their dust baths 1 to 2 inches deep daily. They don't recommend leaving them in the cage all the time, okay? Anybody think why? Wait, no why?
So they don't eat it?
No. They'll get it in their eyes. Okay? If they're dust bathing too much, they'll get it in their eyes, cause conjunctivitis, irritation of the eyes, and that kind of thing. So, if you saw a chinchilla came in with some eye issues, you'd kind of be thinking a couple things. You want to be asking about their dust baths, how often they give them, and how long they leave them in there. Also, you will see that with back teeth issues too. We won't go into that too much, but as you get abscesses up in the teeth, those tooth roots go just right underneath the eye, and that can cause some conjunctivitis issues and stuff too. So, intolerant of heat and humidity, teeth grow constantly, they have to chew on a bunch of stuff, and they need dust baths.
leave us daily.
Daily.
And you don't leave it in there when we go in the lawn.
Yeah.
Because they will make a mess of it. They will play in it forever. As long as you leave the dust back in there, they will be in it.
Yeah, so like I said, do not leave it in the cage about an hour or so. Nutrition, here again, large amounts of roughage, okay? They are coprophagic, just like most of the others. Quality hay with pellets. Now, we'll get into it a little bit more later, but you want to make sure primarily hay, okay, with some pellets. You're going to hear that with ravage, you're going to hear that with other stuff too now. It's changed quite a bit because they need that hay, that really rough stuff to really work those teeth and keep those teeth down and to keep their GI tract moving like it should, okay?
Especially with rabbits.
Yeah.
You need to have some roughage in it. They depend on that, give them a night feast.
Right.
Livestock experiences you call night feast back into the sequel and then recycle. Make sure they have good quality hay.
Yeah, we'll get into that a little bit more and down there too. So, small, when I say small amount of fruits, veggies, seeds, and grain, okay? People love to treat these guys and treat their rabbits with the little yogurt treats and stuff like that. Not good, okay? I really tell people try to avoid that significantly. People
These
must,
guys love raisins.
yeah. But again, it's all that sugar and stuff can be a problem. Fresh water at all times. Because they make a mess out of bowls, water bottles are preferred. Okay? Common diseases. Dental disease. Okay? It can be any of the teeth. You can have dental disease in the incisors, the molars. Commonly, they'll be back in the molars, and it will be difficult for you to see without anesthesia, as we talked about a couple weeks ago. They cause ulcers both on the buccal mucosa and the tongue. Everybody knows what the difference is, right? What's buccal? What was that? Yeah, come on, don't be shy. So the cheeks, depending on which way the little spur is going, okay? Clinical signs, drooling, pawing at the mouth, weight loss because they're not eating right, a poor coat because they can't groom themselves properly, anorexia because it hurts to eat, decreased stool because they're not eating as much, constipation. I kind of questioned this a little bit because a lot of times when they're not having stool, it's because they're not eating enough, not necessarily because it's blocked up. You can get fecal blocks at the end, but it's listed on there, lethargic because they're not eating. It can be genetic. Say their jaw doesn't match up right. They got either a long jaw or short jaw or something like that. Typically not. Or many times not enough roughage in the diet. Here we go again, not enough roughage in the diet. Okay. Teeth trimming is basically how you deal with these. So I've got some pictures there that you can see. You can see big abscess at the top one in the middle. That's commonly like secondary disease, although sometimes it's primary from that tooth being infected. You can see in the skull, the incisors came all the way around. I've actually seen one where it all came all the way around and was sticking up into the palate like that. Okay. If you look at all these pictures, almost any tooth, you can see the one on the left, you see these big points coming down on that one. The E one on the left, you can see how it's growing inside. They can pretty much do all kinds of crazy things in that mouth, okay? And that takes sedation, a scope, blah, 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 to take a look in there. The other day when we were taking a look at that chinchilla, and I didn't know you had that little apparatus, that's the apparatus and how it's used typically, okay, for looking at the mouth. But again, most of what I've seen in the practice regarding chinchillas had to do with dental disease, okay? Skin diseases, poor husbandry, bite wounds, trauma, fur chewing, unthrifty coat. A lot of times these cages are either a little too small or have incompatible animals. Again, husbandry, keeping their cage clean, making sure their cage is safe for them. that can be secondary to dental disease, as we talked about. They can get ringworm, dermatophytosis. Comes in on the contaminated hay or bedding. Looks like any other ringworm, scaly circular areas of hair loss in the face, feet and ears typically. You need to test it due to zoonotic potential. People can get ringworm, okay? Interesting though, like in a dog and a cat, there's like 7 or 8 species of ringworm dogs and cats get, but only like 3 of them are transmissible to people, okay? So I do find it is a lot of times good. I'll send those to the lab and they'll speciate it and I'll go, oh, you might be careful, you might get this one. But first lip, that's the one that they talk about from improper handling. So when you're handling these guys, if you're too rough with them, if you hold on to them, if you scruff them, that fur will come out and you will leave a spot like that, okay? Not a good thing for a client. They will not be happy if you leave a big bald spot on there.
Especially a furry.
Do what?
A furry. A furry, a guy who's making coats out of these.
Oh, yeah. Yeah, if you were making a coat out of that, that'd be not happy.
Matter of fact, the ones that we had in San Francisco, they were all collars full of fur. I asked him, how many of these guys does it take to make a coat? They usually only use females, 250 to make a short coat. I guess that's why it costs so much.
Yeah. Yep. Gastrointestinal diseases. Choke, bloat, trichobezoars, hairballs, enteritis, constipation. Okay, so again, go through your book and take a look at all those. Choke, just like most of the other rodents, they're unable to vomit typically. Okay, so if they ingest something too large, swallow something too big, most of the time it's going to be like bedding or treats. They can't get it down, they can't get it back up, so it's a problem. You'll see similar type things, salivation, anorexia, dyspnea a lot of times because it's putting pressure down there and it can't get it swallowed. Typically we'll find it either on palpation or physical exam on radiographs. Okay? Bloat. Bloat is basically inappropriate diet. It can be due to sudden changes in diet. Can be due to dental disease, it said, poor husbandry, stress, or pain. Okay? You're going to get a guinea pig, a chinchilla that comes in with a really distended and painful belly. Dyspneic, why would it be dyspneic?
Because it's pushing against their.
Yeah, that number one, and what else? Hurts. Okay? Most of these animals, like rabbits and chinchillas, when they get that gastrostasis syndrome when full of gas, it hurts. And then they talk about exercise or decompression. Something like that, you couldn't really decompress, it's too generalized. But if it were like in the stomach or something like that, and it were an emergency, you probably could. I always have trouble sticking needles into things, but most people say it's pretty safe. But you would do that based on the radiographs and stuff. Trichobezoars, hairballs. It's excess fur chewing or low dietary fiber. Back in the early days, I saw a lot of this with rabbits, okay, a lot of trichobezoars. But when we started doing the heavy roughage and hay, I don't hardly see it anymore. So because basically that heavy fiber roughage will grab that hair and pull it through, where when you're feeding a lot of pellet and stuff, there wasn't enough rough fiber there to grab that and pull it through. That's just my personal opinion of what I've seen and what I've kind of been told in lectures. They tend to be lethargic, reluctant to move, anorectic. Again, their belly hurts. Contrast radiographs is typically the way you're going to see it the most. I think it would have to be pretty big to palpate it. Treatment typically is fluids. You give some laxatives. The big thing is increase the dietary fiber. Okay. I don't know why I put plus minus dietary fiber. That was an accident. And during this time, if you need to, you have to assist feed them because again, they can't eat enough And that Oxbow Herbivore Critical Care is pretty great stuff, okay? Enteritis. Proper diet is one of the most important factors when discussing chinchilla care, okay? And this is, again, back to this high fiber, high rich, lots of hay. Because if you think about what they're designed to eat, it's up in the mountains, it's very, very rough stuff, right? So, always when you're taking a history and stuff, you're looking at diet. Usually it will come, again, like in the rabbits and stuff too, not enough hay, poor quality hay, too many pellets, too many fruits and veggies, treats. What it does is it causes a change in that normal gastrointestinal flora, and it allows the pathogenic bacteria to basically overgrow, okay? And that's, again, the same thing with the rabbits and guinea pigs too. It's that too high a sugar gets the pathogenic bacteria, that gut slows down, and everything goes to pot. If they're not pooping, they're not healthy, okay? Parasitic infections, antibiotic therapies, you gotta take a look at that. I guess they're pretty uncommon. Parasites pretty uncommon in the chinchillas, right?
Yeah, chinchillas and Germans rarely have parasites.
They're what?
Rarely have parasites.
Yeah, right, and that's pretty much everything I read too. I've never seen one with them, but again, my experience is limited to the cases I've seen in the clinic. Constipation, impactions, interceptions, rectal prolapse, all signs of enteritis, that gut is not happy. Basically, fluid therapy, pain medications, especially if they're bloated, pain medications, plus minus antibiotics, plus minus antiparasitics. If you do find parasites, you're supposed to check. Respiratory diseases. What kind of made this pretty, yeah,
I'm sorry.
no, go ahead.
What is enteritis? Like,
What is enteritis?
Yeah.
What is itis?
Well, inflammation.
Inflammation of the gut.
Okay.
Yeah.
Okay.
So your gastroenteritis, right? Gastro would be, a gastritis would be infection, inflammation of the stomach. Enteritis would be of the gut, of the intestinal tract. Okay? According to the book, fairly rarely see respiratory diseases in them. If so, it's usually when they're housed in large numbers and poor husbandry. Like any other respiratory disease, depression, dyspnea, nasal discharge, would be the things you're looking for. Again, it said they're pretty uncommon in the pet industry. You didn't see a whole lot of respiratory issues.
What they said, the ones that we got were calls from the fur.
Right. Yeah.
What they do is if they see it, they do research.
Yeah. Yeah, like I said, I have like no experience on these guys on the research side. I'm just kind of going from the clinical side. Whoops. Neurological diseases, again, unlikely in pets. They listed it, so it might be important for you to know for when you're taking your tests or whatever. Listeria is one of the things that can happen. There's no treatment. Again, the book was like, hey, it's super uncommon, you're not gonna probably see this, but I'm guessing they listed it for a reason, so I threw it up there in case on your boards you might see it. You know what I mean? Probably wouldn't be a bad thing there. This is an important one. This is something you will see, it does happen. Fur rings. So basically, it's accumulation of fur that's wrapped around the penis, okay? Physical exam should include manually everting the penis from the prepuce, all right? Not a fun thing, not something I would enjoy doing. But I have clients that have said that, yes, they do this routine, okay? So it is something, if you do have a client that has a male chinchilla, you'll want to let them know, at least, especially if it's a new client, they have to look for this, okay? It causes melanocystitis and paraphimosis. Does anybody know what those two words mean? Grab your phones, look them up, or grab your computers, look it up. I'm gonna make you look these up.
Sometimes it's the generation that won't go away.
Which one? Paraphimosis, it's stuck. Yeah, it won't go away. Usually there's something obstructing it. In this case, it would be like putting a rubber band around it. right? So it's gonna engorge the arterial blood pressure is higher than venous blood pressure, so it can pump blood in, but it can't get out. And so it will get stuck out like that. Dogs, a lot of times it'll happen if they do that, and then the prepuce is small or whatever, and it kind of, what's what I'm looking for? Causes a constriction around it, and then gets stuck out like that. Melanopostatitis. Anybody look it up?
Inflammation of the penis and prepuce.
And the prepuce, yes. So, those are two kind of crazy words, but they're fun words to know. But that is something that you will, be dealing with, and we'll be talking to clients about if you have clients that have male chinchillas. Heat stroke, makes sense, right? All right, so very prone to heat stroke. They say no temperatures over about 80 degrees with high humidity, okay? Basically, the cooler you can keep these guys, the better. You don't want them overheated. Things to think about that clients don't think about: don't keep them near a window, don't keep them in direct sunlight, heater vents, not in the cars in the summer when they're carrying them around or anything like that. That one's kind of simple. But you'd be surprised how many people don't think about windows and heater vents, okay? When we get to reptiles, I'll tell you a story on that, which is my early days of learning something very the hard way. You would treat heat stroke similar to any animal. Okay, get them cooled down. Zoonotic diseases. These are listed. Bacillus procianus. It's a nematode, a worm. It can be in contaminated hay, evidently. It gets in the cerebral spinal fluid, causing ataxia. Anybody know what torticollis is? Who's going to look it up? I'll make you guys look it up. That's the only way you learn. What is it? Stiff neck? Kind of. Is that what it says?
Yeah. Action of the neck muscles causes the neck to twist.
Typically, it's stiff and the twisted neck. Rabbits get the torticollis when they get, that. So, torticollis. Where am I? Yeah, again, I said it would be very, very uncommon. Most of the time, when you get these animals in the pet industry and they're sitting in a home for 10 or 15 years, their contact to diseases are pretty slim. You know what I mean? However, since this can come in the hay, have you ever seen it? The Bacillus aspis?
No.
Yeah. It was listed in your book, so it's in there. Ringworm, of course, if they get ringworm, you can get ringworm. We've already talked about that. Could be zoonotic. Salmonella, again, mainly in production herds. If you found it and they were non-clinical, you don't typically treat it. There's been a lot of stuff, which I agree with a lot of times, is treat your patient, not your lab results. Okay? Sometimes if you get something like that and it were a normal, healthy animal, you wouldn't probably treat it, although you would have to be careful of being clean around it and sheltered and that kind of stuff. Those are the ones that were listed. Behaviors. They're nocturnal. So they can be, the more you kind of work them to be less nocturnal, they can be. But they are basically nocturnal. Supposedly they rarely bite. Highly active little critters. They're fast if they get out in the house or in the exam room. You hear enough, that might catch them. So I tell stories about this all the time. Whenever you've got a critter like this in an exam room, make sure your doors are closed. Make sure your ceiling tiles are good, because they can go from here to a cabinet up in the ceiling, then you're screwed. Okay? I've had people with cats that did that. The other thing, if you start seeing small animals in a practice like this, check underneath your cabinets. Okay? A lot of times the cabinets make those cabinets, they leave little areas open. And one day a client was in there with a ferret, and the ferret disappeared. And we're like, where did the ferret go? And it snuck up underneath the cabinet. Okay? So after that, I had to stuff something up in there. So if clients will do whatever they want to do. If clients have their animal running around their thing, they're not getting it up in the cabinet. So again, think about these things. I tell stories too about the first time I was seeing sugar gliders. They're fast, little, tiny little things, right? Doors closed, everything was all set. I thought I was good. And client takes it out. That little thing took off, went underneath the crack in the door, and got into my dog food room. Okay? So pulling out tons of dog food looking for a little sugar glider was not a fun ordeal and a little embarrassing. So whenever I see sugar gliders, I bring little towels in the room and I stuff them underneath the doors before I ever take them out. Okay? There's another trick with hamsters. We'll talk about when we get to hamsters about bad experiences that happen with hamsters. You can learn from my bad experiences. Okay?
That happened with monkeys. Monkeys have hands, they get up and push those things.
Oh yeah, a monkey? Yeah, that's a whole different ball game. They can get wherever they want to go.
When they get on top of the cabinets like this, they just push the tiles up.
Yeah.
I had one get up inside the tiles at Netherman Army Institute of Research, and he was up there for a year.
Yeah, I believe it. I believe it.
He'd come down at night when everybody was gone, take the food from the monkeys that were caged, and go back upstairs.
Yeah. I mean, security is real. I believe that in a monkey. I've heard of clients, I've heard of clinics that have had cats up in the roof for weeks, and having to try to track it down. So those little tile things up there are not secure enough to keep a cat from hitting it and going up through there. Okay? So just, you gotta be careful in handling some of these animals. Caging. It can get pretty elaborate, it gets pretty neat, and to me, on something like this, and most animals, the biggest you can get that you can either afford or have space for, the better, okay? Again, these guys come from little rocky areas up in the mountains, they like to jump, they like to move around a lot, so they need space. Multiple level cages work really well. Big things are, and you'll see it in some of the cages, the little ladders many times are wire, and there's a lot of controversy because the wire can also catch a leg, catch a foot when they're bouncing around, break a leg, break a foot. The wires can also cause a lot of damage to the feet, photodermatitis, giving them bumblefoot and skin and infections there. So you've got to make sure that they have a lot of flat areas. Typically you'll see them use wood or that kind of thing that they're sitting on that's not going to hurt their feet. Okay? A lot of these cages you'll see they'll have like a wire bottom so the poop can fall through, and that's okay, but again, make sure it's appropriate size so their feet don't get caught. Any questions at this point? You guys are welcome to yell out in the middle of my lectures and ask questions, okay? As long as it's pertinent to what I'm talking about. But there are quite a few of these on the market. I watched quite a few little videos on cages and stuff like that for them. To me, the biggest thing would be giving them enough room. You know what I mean? Because they are active. So what you're going to need to do, history and physical exam. Again, husbandry is the most significant factor that you need to get information on. How are they housed? Do they have cage mates? What's their diet? How old are they? Blah, 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 blah. Okay? As in any animal, a preliminary observation is vital before touching the patient. You go in and take, has anybody talked to you about this so far? You have. When you go in and take your history, and when I go in and I start talking to them, half the time, I'm listening to the clients, but they're giving me so much extraneous information, it's not even funny. Most of the time, I'm watching that animal. How's it acting? How's it stooling? How's it looking in the cage? Especially when you're dealing with exotics, sometimes these guys got to be anesthetized. You really get a good exam on them. You're not going to see the little things. Their eyes are droopy. They're, droopy. You're not going to see that stuff. So always, 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 always take time to get good observation on them before you even ever think about touching them. Okay. Close doors, like we talked about. Make sure that room is secure before removing the patient from the cage. Most clients are pretty good, but they're not great sometimes and don't realize their animal's in a strange place and is going to do strange things. You know what I mean? And going to be more nervous and scared. But I will say a lot of them, the clients are pretty good about getting them out and holding on to them, and I try to do my exam while the client's holding them a lot of times, you know, if I'm gonna do them awake. You wanna make sure they're bright and alert, of course, twitching their little nose, they're not open mouth breathing, tail's typically up and erect, and they got soft, smooth hair color. Okay, because again, we were talking about dental disease, blah, 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 will give you a bad hair coat, but you want to see a nice, happy little critter. Never scruff them. Okay, that's what can happen when you get that first slip. You don't want to scruff them. You want to hold them to the base of the tail and the hind legs in one hand while the other supports the chest and the shoulders. Okay. The other thing that I really do recommend when you're dealing with an animal that can jump out of your hands, get low to the ground. Okay. You don't want to be standing up here and have him jump out and break his leg. Not a good thing to happen in practice, right? So if you're questioning, get low on the ground, get on your knees with him. Then this way, if he does jump, he's not falling so far, okay? But those are things that you can do to help prevent injuries should they jump. That's kind of what we're gonna go over in lecture and lab, in lab, is handling quite a bit and getting used to that. Getting the vitals. I'm a big fan a lot of times of the little critter cages for getting weights on a lot of animals. You don't have to worry about them jumping off the table and doing all kinds of crazy things. So I like in my practice, I always had a variety of these around. Even if I've got a bird, I've got something like that, you stick that on the scale, weigh it, put them in, you get your weight that way. One on the left, similar, although it's a little guy, he's not going too far, so they got him just in like a little cup there. I would be a little nervous of the one in the middle. You see, he's actually in a cage, I guess. So I guess you could put it in the cage and you would just step on it, but I think that would be personally kind of difficult to get, okay? Weights typically between 400 and 600 grams. Females tend to be bigger than the males, okay? Body temps, 97 to 102. Now, personally, in my practice, when it came to ferrets and chinchillas and stuff, I didn't do a lot of body temps. Stress can make it go high, a lot of things can make it go high, and you can do more trauma than good sometimes by sticking that thing up there. One of the things that was talked about in the book too is the little ear clicker ones. They're not great, but they're close enough a lot of times for something like this. That would be, in my opinion, ideal. Now, if I had a sick one that was in and you could handle pretty easily, yes, I want the temperature. You know what I mean? But I think the ones here are used to getting temperatures, right? Did you guys do? You don't do it when you do your.
We don't do it.
Oh, second years, okay. I'm still learning. So I think that ones here are more used to it, so definitely, get it from the ones that are here. Heart rates, fast, okay, 200 to 300. Sometimes that can be very difficult to count, but you can kind of get a both. You know what I mean? Respiratory rate, 40 to 80. They're a little fast on respiratory rates. Anesthesia. I'm a little different than some veterinarians out there. Anesthesia is your friend when it comes to most of these crazy exotics. Okay? And I was so glad the book said this. The book said isoflurane, sevoflurane are the preferred use for minor procedures and exams. I will 100% agree with that. If you are out there and you find yourself working with some of these exotic animal veterinarians out there now, they will disagree with you on this, okay? And they're the vet, they get to do what they want to do, and you gotta get used to what they want. There is one of the heads of the exotic animal veterinary group who is big time into multimodal anesthesia. One of her lectures years ago was it's great to sedate. Basically, every rabbit that walked through the door got intranasal midazolam. Okay, she's like, they're prey species, they stress, you give them a little midazolam. So you will find differences of opinions out there, doctors. That is okay, as long as it's kind of approved. Me personally, I'm a big fan of the top left corner, put them in a little cage, or if you can't, put them in a little burrito, give them a little gas. You guys are both better off. Less stress on the animal, in my opinion, less stress on you, less stress of hurting the animal. Okay? Once they're under, a lot of times, a little face mask, sometimes we'll just hold it in place, that type of thing. Big thing, you're always going to use a non-rebreathe, in my opinion. The one up there looks like it's like one of those rebreathe ones. I'm not a fan of that. We'll go with that, my personal opinion, fly later. But a non-rebreather on these little tiny ones. Okay. Like I say, injectables can be used depending on your veterinarian's experience and what their thoughts are. Midazolam's common. Xylazine we don't see anymore. Dexdomitor is probably the one that's most commonly used. Ketamine, butorphanol, ACE, those can all be done in different combinations. There's a lot of different cocktails out there for these little guys. And typically, to me, it's less stressful on the animal to put them in a little chamber, knock them down, than it is to try to hold them for the injection. So that's just my 2 cents. The anesthesia is your friend. Radiology usually requires anesthesia, in my humble opinion. Okay? There are a lot of people out there that don't, that are afraid of it more, and God, I just see more stress on that animal. If you holding this little thing down for a decent radiograph is going to be almost very difficult. It's going to happen. And you don't all know me, but from the radiology and from that kind of stuff, I'm a stickler when it comes to my radiographs. They have to be proper or they're not readable. So if you can't get a good lateral, if your legs are doing this, if things are being all oddball, I'm not going to use that as a diagnostic radiograph. Okay? So it usually requires anesthesia. In general, they have a small thorax in comparison to the abdomen when we look at it. So that was a point that they brought up. But dental disease and stuff, people definitely do a lot of. That would be where your radiology would be very important. That's fairly normal radiograph for dental disease or for teeth on a skull. That would be a bloat in the center there. And the other thing I've seen them for is broken legs, bad caging where they get it stuck in their cage or jump wrong and they'll break a leg. Parasitology, uncommon in our pet chinchillas. According to the book, fecal should be done. They can get protozoal infections, supposedly. Trichomonas, Valentinium, Cryptosporidium, malaria. They can also get supposedly some nematodes or worms, Phyciloptera and Pneumocus. And supposedly they can get fleas. I don't know, we live in that. I haven't seen a lot of fleas. And tapeworms. Many times tapeworms are related to your fleas. You guys had the tapeworm, you know much about tapeworms yet? They'll be too hose, either fleas and stuff or other small animals. Urinalysis. Kind of have a high pH, 8.5. Typically a specific gravity of 1045, which would be dilute or concentrated compared to a dog. Concentrated. Yeah, think about it. The desert, right? You're going to conserve the water. I like to try to make things make sense, because then you'll remember. You know what I mean? If on a test it was like, would you expect a specific gravity of 1010, 1025, or 1045? You go, they live in the desert, probably hot, right? Makes sense out of things. Normal abnormals, I call them things you can commonly see that you would find some might think were abnormals. They can have calcium carbonate crystals and amorphous debris. All right. Anytime you get a real concentrated urine, you can have jumping because it's concentrated. You know, and that's the thing you always got to be aware of too. The more concentrated your urine is in any animal, the more likely you are to have things there normally that aren't normally there. The more dilute. So if you had a dog with very dilute urine and had a 1+ protein, it will mean more than if I had a dog that had a very concentrated urine that had a 1+ protein. Make sense? Okay. What have we done? There. Venous access. Preferably anesthetized. I don't know if I could hit that little vein if I had to do it the way. Although, I have technicians that can and have, okay? And a lot of it's gonna depend on the patient too. You got a really sick patient that's like trying to die, you're probably not gonna want to anesthetize, right? So, jugular vein, jugular cranial vena cava has become probably the most common site you're going to get like a blood sample from. Okay, cephalic vein, saphenous veins you can hit, femoral veins, lateral abdominal vein, a tail vein. I was like, really? When we see that in reptiles a lot, it was listed. But if I were going after a blood sample for diagnostics, jugular cranial vena cava would be my choice. Okay, this is why. And we were talking about it a while back, and I was like, oh, we have this great picture, and then I actually found it on the internet. The one on the left, you should know that photo well, okay? Because if you're having to take jugulars or cranial vena cava sticks, having that in your brain of where those vessels lay is very important, okay? Many times, typically like when you're doing a dog and stuff or cat, you're pointing up towards the head, okay? When you're doing this, you're pointing the other way around, okay? And many times if they're under anesthesia, it's actually a little easier that way, depending on how long the neck is and what you can see. I mean, ideally, if I can see a jugular vein, I'm going straight before cranial vena cava. I've done a lot of cranial vena cavas. I will tell you, I hold my breath, even though I've never had a problem, and they tell you it's very safe. But it's just weird sticking that needle in the chest and going, oh, where is it? So, long story short, both jugular veins come together into the cranial vena cava right there. It comes together right inside this front little notch up in the sternum, right? Everybody know what that's called? The what? Say it out loud. Be brave. Oh, come on. Got it right. Trust me. Maneuvering. So, you'll see like on the right-hand side picture, basically what you're doing, if you look at the anatomy, is you've got him on his back, you're laying on his back, you go between the maneuvering and that first rib, okay? You stay very superficial, so you're going just inside because think about it, those vessels come right here and then they go in, right? And so, and then you're pointing your needle basically back towards the opposite hip, okay? And then once you get through the skin, you hold a little bit of pressure back and then just advance forward. When you hit it, when you hit it, it'll give you good flow when you hit it right, okay? There's no way to hold it off. That's the thing that's kind of freaky. But usually when you're using a 25 gauge needle, it's not a big deal, okay? Whenever you're drawing blood, and in my opinion on cats and any small mammal, draw back slowly, okay? It drives me nuts when I watch technicians like pull way back on the syringe, right? Because what's gonna happen? You're gonna collapse the vein. Easy. When that vein's not hardly bigger than your 25 gauge needle, you can't pull back. Okay? Most of the time what I would do is I'll tap it back a little bit and I'll let it go and let it flow into it. And then when it fills up, pull back just a little more. Let it go. Okay? Some people will actually just put the needle in and let it flow back and draw from that, especially in your little cuvette type things. Or you can do all kinds of different things, but God, don't pull back on a 3cc syringe. You will collapse that thing without a doubt. Okay? So that's the other good thing. So draw back slowly. IV catheters, cephalic. I had a technician years ago who was amazing at this. She could put a cephalic catheter in any ferret, any little critter I ever had. It can be done. It takes a little practice and talent. So the more you do the little caps, the more you do the dehydrated caps, the more you will become comfortable enough to do this. Okay? Said the lateral saphenous, I couldn't find a picture, couldn't find anywhere that showed an IV catheter in the lateral saphenous, so That, I just put a question mark by it, but it's there in the book. This is one that actually, in all honesty, in a lot of our small exotics, is a very, very, very commonly used way to access the vascular churn, vascular access, okay? Interosseous catheter. It's kind of odd. And a lot of the photos that I saw online, I was like, that was bad placement. But typically, the femur or the tibia are the common places. You can use anything. I've seen it in the humerus. That's another one that they'll use sometimes. I've seen it even in the pelvis and birds. They'll use the radius and ulna a lot of times because it's right accessible right here. But it's actually pretty simple and it works really well. You do have to do a good job of shading and prepping because you are sticking something in the bone, so you don't want to drag bacteria in there. You don't want to see your veterinarian just shoving a needle in there without doing a decent prep. And believe me, it happens, but you can holler at your veterinarian. But in this thing, it said the femur was the preferred site due to its size and location. Oh shoot, I didn't get one up there. So the femur, the advantage would be is you would have a little port sticking out way up here, so it wouldn't get in the way as much, okay? I have found, and I haven't done chinchillas a lot, but I have found that sometimes the femur is harder because the bone's a little more dense. The other common place is in the tibia, and it's really simple there because you bend the knee, you feel the tibial crest, you come in just a little bit and feel that tibia and just drive it right down parallel. Once you get inside, it will go. Once you're in the bone marrow, okay? They'll tell you use a 22 gauge needle with a spinal needle because it has a stylet in there, right? Because sometimes when you're coring through that bone, that little piece of bone will get stuck into the needle and it won't flow, okay? But if you have a stylet in there, it works much better, okay? For emergency situations, for surgeries, for all kinds of things, this is a great access, and it works, okay? And it's surprisingly how much fluid that you can deliver into the bone, just like you would an IV line, okay? But if you think about it, all your blood comes from the bone marrow anyway, right? So it has perfect access. So in a lot of small animal exotics, this is a common way of getting vascular access. Now, I probably would say, and I haven't done it, I wouldn't be like injecting Genocin or any like caustic type stuff into it that way. But would I use it for IV fluids during surgery and stuff like that? Yes. Okay. Common way of doing it. So that's something you should probably get yourself familiar with if you're going to do that. This was kind of stupid to me, but it was in the book. Same as every other animal. You can give medications either orally, you can give them under skin. Typically 25 gauge needles, you're going to be fine on most of these animals, okay? IM, it says less than about 0.3 mils per site. So you just don't want to put a bunch of stuff in one site. It won't absorb as well and it can be irritating to the muscle, okay? IV, you could go as low as like a 28 gauge needle if you have one, like an insulin needle in the cephalic or the lateral saphenous. You know, lateral saphenous is and medial saphenous is a lot of times probably your most accessible vein if you're going to do something like that once. Euthanasia. When you have to, anesthetize first. I typically will gas them down to whatever. If you've got a catheter in, of course, you can just put it right in there. But I wouldn't muck around trying to get a catheter in to a chinchilla that was really sick and trying to die. I'd give them a little gas. And if you can't get a vein and the gas, just hit them in the cardiac. Okay? Basically, everything came from the left book, your exotic animal medicine. Know that book well. Okay, I'm teaching primarily from that because I think since that's your book, I'm guessing when it comes to boards, that's where most of your stuff's going to come from. If anybody's really in a clinic that does a lot of exotics, that one on the left, Robin Road and Dentistry, by Dr. Capello, that is an amazing dentistry book. Okay, if anybody's really interested and wants to look at it, let me know. I can bring it with me. But that has everything we need to know about dentistry in small animals. Okay? I think that's it. Any questions? Everybody know everything you need to know about chinchillas?
Oh, yeah.
Doc, anything you want to add? Covered it pretty well? Thank you.
Try.
All right.
You know, we didn't really mention much about like, their eyes and stuff.
Their eyes?
Yeah, minus like if you get sand in there and stuff.
Yeah.
Like, do they have like issues typically? Like,
Again, I don't see a lot of them in practice, but yes, I would think trauma would be one thing you commonly see if they get in a fight or rub in the cage or do whatever like that. Oh, something I brought, oh God, I missed it on there. You'll get these clients a lot of times, whether it's a ferret, you don't see as much in ferret rabbits, but I'll see it in birds and I'll see it in potentially chinchillas, where they're trying to save money, make their own cages, okay? You have to ask them about their cages because there's two types of wire out there for you guys to know. There's what's called welded wire and then there's hardware wire, right? Welded wire actually is each corner is welded. That's safe, okay? Most of the stuff you see out there in the hardware store is hardware wire, okay? Which is soldered at each one. What is soldering?
you just put two pieces of metal together.
Yeah, but what metal?
It depends on the solder.
Do what? Say that loud.
No.
You guys are gonna quit being shy. Zinc and lead, right? Most of the time it's zinc. So if you've got a cage that a client has built that has zinc in it and your animal's sick, guess what? He may have zinc and lead toxicity. And that's where history can give you a huge advantage, okay? And you don't know how many birds I've seen with zinc and lead toxicity that chewed those little things on the corners of homemade cages, okay? So that is something to always check. Like this, you know, they're trying to build a big cage, and so they're trying to save money and build it themselves, and they get hardware cloth at the hardware store, it's got zinc and lead, okay? What else? Oh, eyes. I would think, especially if their hand, I would imagine they can get almost anything that any animal can, you know? I'm sure if I would had an ophthalmologist in the room, he'd be like, yeah, trauma, punctures, you know, glaucoma, whatever. But for the most part, not something that is like specific to them.
Yeah, gotcha.
You know what I mean?
Yeah, I was just because you said a lot of geriatric stuff with that. So I was figuring.
And most of the ones I've seen in practice are either, I just got my chinchilla and can you look at it and make sure it's healthy? Or it's a 15, 16, 17-year-old one that's not eating, not doing well, has had poor diet, teeth are bad, that kind of thing. Had one big abscess on the lower jaw, kind of similar to that photo type thing, not as bad. And that thing was on antibiotics for probably 8 or 9 months, okay? You do gotta be careful with antibiotics in chinchillas also. Thought I covered that, but I didn't. They are susceptible to the same enteritis issues and that kind of thing that your rabbits and your rats and all of them are. And why is that?
Because they have big specialty bacteria.
Yeah. Yeah, and if you kill their bacteria, they can't digest properly, so they're gonna have major issues, right? So, 2 cents for me is when I've had a few rabbits that have had really, really bad abscesses, oral abscesses like that, this chinchilla that I was talking about. Unfortunately, penicillin is probably the best drug against the bacteria, but penicillin is the worst drug for the gut. So if you go injectable, sometimes you can sneak around that. But it's something you would not be doing, your veterinarian would be talking to your client about seriously. You know, because a couple of those, I'm like, hey, we can maybe do it. It's a salvage procedure. We're going to lose them if we don't. You know, because you've been on every other thing I can give them. Or we can try this, and if we're lucky, we can save them. If we're not, we're no worse off than we were if we could lose them anyway. You know what I mean? And I have cleared a few things up with injectable penicillin. It does work. I had a rabbit one time came in that we thought, and I'm sorry, I love telling stories, so you don't like to yell at me. Rabbit came in one time as a breed second opinion from another veterinarian. They thought it had a diaphragmatic hernia. When you took the radiograph, it looked like it because it looked like a solid mass right in front of the diaphragm. So we actually went into surgery assuming it was a diaphragmatic hernia is what it kind of looked like. And so opened this rabbit up, peeled the liver back, and I was like, there's no hernia. That was a big abscess, okay? So we drained it best we could, but their abscesses are like cottage cheese, or not cottage cheese, cream cheese. They don't drain, they're just really thick. So that rabbit was on injectable penicillin for 7 or 8 months, and it actually went away. So sometimes long shots help do work, but they're long shots. Other questions, anything else? I don't think we have a whole lot in the lab other than I want you guys to learn how to extract that penis so you can take a look at it and check for, I know, something I would make my technicians do.
Steven's actually good at this.